I'm Dr. Alex Williams. This is Entitled Carbon Dioxide Predicts Acute Mountain Sickness Better Than Altitude. A variety of methods have been looked at to assess who will develop acute mountain sickness during ascent. Current physiologic predictors have limitations. Prior studies have evaluated this, looking at pulse ox and heart rate variability. These have had mixed accuracy. The primary physiologic understanding of this principle that governs acute mountain sickness is the hypoxic ventilatory response. This study sought to use Tidal as a means to assess for acute mountain sickness. Principle we're very familiar with in emergency department. This looks at a marker of ventilation, but also as a function of cellular respiration. The purpose of this study was to determine if a change in baseline end-tidal carbon dioxide predicts a development of acute mountain sickness as well as altitude does. So we did this by creating a prospective cohort study of 3 separate high altitude tracks at these 3 sites. Our primary predictor was the net change in end-tidal CO2 using an FDA-approved device that was a portable capnometer, as well as evaluating the altitude. Our primary outcome that we looked at was the Lake Louise Acute Mountain Sickness score. We deemed those to have a score greater or equal to 3 as being positive for acute mountain sickness. Baseline end-tidal CO2 measurements were obtained at the base before the hike. These scores were conducted by a trained investigator daily and at the summit. These were measured concurrently with altitude and end-tidal CO2. We recorded the demographics and developed a ROC curve for each predictor. Here's a picture of the devices that we used. 21 hikers and 3 separate hikes were included in this study. They all completed the respective hikes. They all resided at sea level prior. 5 developed mild acute mountain sickness. The demographics were included here. Of the 25% that took dexamethasone, 50% took acetazolamide. Those were all members that were on the Kilimanjaro hike. A total of 166 data points were measured, and 9 reached a acute mountain sickness score of greater than 3. The mean daily end-tidal CO2 change from baseline was 5. The mean end-tidal CO2 without acute mountain sickness was 24, and with acute mountain sickness was 19. Here's a look at our ROC curve demonstrating that end-tidal is actually a better predictor of altitude than elevation itself with regards to sensitivity and specificity. These were not statistically significant, but there is a difference shown. So we used a cutoff of end-tidal CO2 less than 22 as a predictor for acute mountain sickness. This had a sensitivity of 100% and a specificity of 60.5%. Again, not reaching statistical significance, but showing a difference nonetheless. This is our mean end-tidal CO2 versus altitude, demonstrating the relationships as a function of time, and that as altitude increases, the end-tidal decreases. So previous studies have met this topic with variable results. Initially postulated pure ventilatory response would suggest an increase in end-tidal CO2 with altitude. We initially expected the non-symptomatic hikers to have an increase in end-tidal CO2, as well as the symptomatic individuals to have a decrease in CO2. End-tidal CO2. What we actually found was that everyone had a decrease in end-tidal CO2, but those that were affected by acute mountain sickness had a greater decrease in end tidal CO2. This shows that disturbances in oxygen utilization at the cellular level may also explain a lower end tidal CO2. This is similar to the concept of lactate. Now, nonetheless, again, it suggests there is a mixed response at play. So some limitations very briefly, it was observational. There was no minute ventilation. If we were redoing this, we'd include a respiratory rate. But to conclude, it was the first study to examine the relationship between the two, and Tidal predicted acute mountain sickness better than altitude, and it may have continued use in the future. We'd like to acknowledge Massimo for contributing the device that we used in this study. Any questions can be directed to this email address. Thank you for your time.